In this clinical teaching guide, we will focus on teaching clinical reasoning. Clinical reasoning is the cognitive and affective steps up to and including arriving at a diagnosis and management plan that is specific to a patient's circumstances and preferences. The first principle is that clinical reasoning requires rich content. Clinical reasoning is content or case specific. To be effective at clinical reasoning, one needs a broad and deep fund of knowledge of the conditions and their treatment and practice. Check out some of the strategies for teaching clinical reasoning below, according to Principle 1. The second principle is that clinical reasoning requires multiple strategies, flexibility, and prolonged effort. Use non-analytic reasoning to recognize patterns, and use analytic reasoning to rule out scenarios and determine your approach. Check out some of the strategies for teaching clinical reasoning below, according to Principle 2. The third principle is that clinical reasoning is impacted by motivation and emotion. Attention to motivation and emotions can enhance clinical reasoning instruction. The interplay between cognition, emotion, and motivation has implications for clinical practice and education. Check out some of the strategies for teaching clinical reasoning below, according to Principle 3. The fourth principle is that clinical reasoning is context-specific. This refers to the phenomenon of a physician seeing two patients with the same presenting symptoms, findings, and diagnosis, and yet the physician comes to two different diagnostic decisions. Check out some of the strategies for teaching clinical reasoning below, according to the fourth principle. Here are some key points to remember. A broad, organized knowledge base is crucial for success. Instructors should make what is implicit explicit. Versatility in reasoning and strategies enabling non-analytic and analytic reasoning is key. The influence of emotion and motivation on reasoning should be recognized and integrated into teaching methods. Clinical reasoning is context-dependent, and instruction should not only be authentic, but also take into account what is going on in a specific care encounter, reflecting the realities of diverse clinical environments. This video is produced by the Office of Faculty Affairs and Development at the Burnett School of Medicine. Thank you for watching.